Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. BScN's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
I'd like to welcome our audience to today's episode, where we're going to be speaking with Thomas Hinneh about a wide variety of topics. So I'm going to let him introduce himself to you.
Hello, everyone. My name is Thomas Hinneh. I'm actually from Ghana. I'm a staff of the Ghana Health Service. I'm a professional nurse and a public health practitioner. I'm the founder and executive director of HIV Foundation Ghana, an NGO creating awareness for hypertension and diabetes in community settings, specifically rural communities. I'm currently a student at the Johns Hopkins University, specifically the School of Nursing, and I'm happy to be here today. Thank you.
We're so glad to have you as a guest on our podcast. And let's start off talking about team-based care. I think that's a word or a phrase that we use across the globe, and it might be a little bit different depending upon where you are, if you've got a staff that's small, a staff that's large. So how can we address CVD prevention using team-based care and making sure that we are appropriately treating our patients?
Thank you very much for this question. Before I begin, let me be quick to say that in the last 10 years, the burden of CVD, particularly in low-middle-income countries, including Ghana, has grown significantly. And when you look at the number of physicians we have, especially in Ghana, we'll never be able to meet the needs of our patients without working together as a team. And so team-based care, as WHO has recommended for low-middle-income countries, is an approach where you have two or more healthcare providers coming together to provide a patient-centered care as far as hypertension management is concerned.
And team-based care can be used for a lot of other disease states as well. So hypertension is the one on which we're going to focus today, but I'd like our listeners to kind of think about the other disease states that they may be managing as well and how that might be applicable there as well. So what are the special considerations when you have a small team of two people that are doing that team-based care? What are some key qualities that you think that make that effective?
Great, thank you. So when I talk about team-based care, I always love to reflect on my previous experiences working in some district hospitals in Ghana. And I believe that one of the most important elements of an effective team-based care is the clarity of roles. When people come on board to work together, there should be a distinction as to the specific roles that they will play in the team. And so working together with medical doctors, nutritionists, pharmacists, and all cadre of healthcare workers, one thing that stood out was that everybody came on board with specific responsibilities. So on a usual day, I would actually coordinate the clinic activities, but I had nutritional officers coming in to give nutritional support in terms of counseling, health education with patients. I had the nurses coming in to check the blood pressure of patients, almost everyone. And then I will facilitate, the counseling sessions and the health education and the focus group discussions. And after those sessions, I will switch to the consulting room to do some prescriptions. And sometimes you have the pharmacist also come in to, lead some interventions that will help in medication adherence. So one of the important elements is to have every member on the team having a specific role to play. Another element I would want to talk about is leadership, more of a collective leadership. And when I talk about collective leadership, every member of the team should be able to, live with the understanding that they own the clinic. And so we're able to leverage on individuals' competencies, and the clinic doesn't center around one person, but we all come together as a team with the thinking that the clinic is for us and for the patient. So collective leadership, clarity of roles, these are two outstanding elements for a successful team-based care approach to hypertension management.
I really appreciate those great perspectives on what it takes to actually get patient outcomes improving, working together as part of a team, no matter the size of that team. That's wonderful. And one of the things that happens on a team is sometimes we have new to career individuals, students perhaps, or early career nurses or other providers. And I'm wondering about your perspectives about providing mentoring for those individuals and how that plays into your daily clinical life and the outcome of our patients.
Thank you for this question. And I must be quick to say that I have benefited significantly from, a lot of senior officers of the Ghana Health Service that I've worked with in the past. And I remember when I started my, the journey of, being a nurse in somewhere 2015, I had the privilege to work with a district director who is retired now, who gave me the opportunity to, as it were, express what I'm thinking, all the ideas I had in mind. And that was when I actually conceptualized the idea of team-based care. Far before 2018, when the idea of team-based care approach to management hypertension became more popular. They gave me the platform to showcase all the skills I have. And I believe that for students and early, career researchers, those who want to go more into CVD, you need to tap into the experience of those who have gone ahead of us. Usually they know more than we know. We should not allow, sometimes I call it useful exuberance and over-commitment to make change, to lead you. Sometimes people have experienced things that we have not, and it is good to allow them to, as it were, guide you. But I must also say that in terms of my research journey, I had the opportunity to meet a lot of people like my current advisor, Professor Yvonne Commodore-Mensah, who is doing almost the same thing that I have, been doing in the past 7 years. And she has actually shown me, potential career trajectories that could, build on all the experiences and all the things I've done. And she continues to link me to all the potential networks that are significant to my career improvement. And so I believe that, yes, we have intrinsic motivation, we have intrinsic passion to succeed, to improve life, to make changes. But when we link, when we network with the relevant people, they're able to guide us. They serve as some sort of accountability by setting timelines for achievement of goals and so on and so forth. So there is this saying that if you want to go far, don't go alone, go with people. And I believe that mentorship is the best approach to achieving a lot as far as cardiovascular research is concerned.
Thank you so much. We're going to take a quick break, and we will be right back.
For more education, resources, and tools for your clinical practice, visit pcna.net. You'll find CE courses, patient handouts, and more, all free to access. Visit pcna.net.
And we're back, and we're going to shift gears just a little bit and talk about patient-centered care. Thomas, what are your thoughts on that?
Thank you very much for this question. I believe that the central goal of team-based care approach to management of hypertension is patient-centeredness. Hypertension is a chronic condition, and so it requires an ongoing management as well as lifestyle modification. But the point is that when we talk about lifestyle modification, we expect it from the patient. It is the patient who is at the center of all the interventions that we design. And so to be able to achieve an optimal blood pressure control, which is the goal of the healthcare interventions we deliver around hypertension care, we need to have the patient at the center. And when I say we need to have the patient at the center, we need to put measures in place that will encourage them to voice out their concerns. I often tell people it is not easy to live on daily medications. And so when somebody is going through that phase of life, you need to be able to have them speak up, put in mechanisms that will enable them to let them tell you how they feel and what will work for them. And so patient-centeredness is the only way we can get patients speak up and engage with them meaningfully. Another important point about patient-centeredness is the fact that it leads to patient satisfaction. And I say this with some of the experiences I've had in the past, that anytime I engage with my patients in the consulting room, so meaningfully that they're able to speak openly as if they are in their houses and so on and so forth, they leave the consulting rooms very satisfied. And so when you meet them outside and say, how was your experience today? Oh, today was very nice. The only reason why it is nice was because they had engaged with somebody in the consulting room very meaningfully. So to be able to, achieve the goal, achieve the purpose for which we use team-based care, we need to engage the patients appropriately. Let them have a say in the interventions we deliver. And I always say, a satisfied patient is the most engaged patient.
Wonderful thoughts. And so let's think about our patients with hypertension specifically. And obviously we want patient-centered engagement. We want patient-centeredness, as you've described it. But how do we help our patients understand the links between their hypertension, diabetes, and also cardiovascular disease?
Thank you very much. And I must be quick to say that most of the patients that I've nursed so far had both hypertension and diabetes. And so the first point is to create some sort of awareness. You would think that anyone who has diabetes, anyone who has hypertension knows that they are at risk of developing either, but that is not really the case. Most of them are unaware. So the first step is to raise the awareness. Let them know once you have hypertension, there is a risk of also developing diabetes and vice versa. And I remember when we went for some visits in Ghana with my advisor, Professor Yvonne Komodo-Mensah, one of the recommendations that we had from some of the key stakeholders was to deeply investigate the relationship between developing diabetes and hypertension. And I always say that if somebody lives with hypertension, it is quite a lot. It takes a lot to overcome. But when they have the two, then the responsibility is double. And so the first step after creating awareness is to let them know the risk factors that leads into developing the other. So once they now know, okay, so I have diabetes, I'm at risk of developing hypertension, okay, some of the other complications that I'm likely to develop are so and so, then it helps them, it gives them some sort of awareness that they live with, and that goes into informing all the healthcare decisions or all the nutritional choices and all the other, decisions you can think of. So the first step is let them be aware of it and guide them on how to, prevent themselves from developing it. But I also touch on the health system perspective. Apart from letting the patients know, healthcare providers must also know that our patients are at risk of developing comorbidities. And so efforts like cardiovascular risk assessment, which is often not done in Africa, we should aim at, prioritizing some of those interventions. And there is actually a study in Ghana where nurses were actually involved in cardiovascular risk assessment, and the end result was improved, blood pressure control and, others. So I think it is really relevant that moving forward, we pay a bit of attention into, managing hypertension, diabetes, comorbidity. And I must emphasize that the projects we currently have ongoing in Ghana, which is funded by PSF, actually brought to light the number of patients who have both hypertension and diabetes. And we are hoping that the data will help us to, come up with some interventions to see how we can predict their risk of CVD events, which will inadvertently contribute to designing interventions that will protect them from developing such events.
And the last question I have for you is about the motivation and inspiration that healthcare professionals have or maybe need more of for preventing cardiovascular disease and for managing it. How do you find motivation? Everybody is very busy anymore. It doesn't seem like there's enough hours in the day for everything. So how do you nurture that?
That is a great question. And it's actually something I've never, said anywhere. I think that as early as 7 years, I lived with a grandmother who, had both hypertension and diabetes. And I witnessed firsthand how stressful it is to live with the two. Those were the days that people stigmatized living with diabetes. Those were the days that you leave home at 6 a.m. to go for clinical appointment and get back home at 6 p.m. And so I imagined how stressful life was. And anytime I had conversations with her, I could feel the pain. But at the time, I had one thing on mind, how can we make health services more accessible? How can we put things in place so that people living with, hypertension, diabetes, or both can live a meaningful life? And I regret to say that the most popular recommendations at the time was to live on 1 finger of plantain a day. And so anytime people leave home, she was alone, she would say, hey guys, come and help me. We will help her prepare what she loves to eat. But sadly, the next day, her blood sugar will shoot up. And, that was the first time I've seen people, experience seizures because of high blood sugar. It was bad. So right from day one, I think I knew what I wanted to do. And so when I started my professional journey as a nurse in a district hospital in Ghana, and I was in the consulting room and I saw people come in, just getting their medications and going, I felt like, no, there could be more to this. And so I started something like a focus group discussion with just 5 patients. The next week, the number increased to about 12 until the number shot up to 200 because the patient felt I was providing services that met their needs. And so I'm always inspired by the experiences that my grandmother went through, and I'm committed to going further. And so sometimes, even though there are challenges, it's not easy. Resources are inadequate, health systems itself are something else. But I feel like when I imagine the challenges, she went through, I feel people should not go through the same. And I try as much as possible to do whatever I can within my capacity to, come up with some interventions that will improve hypertension and diabetes care. And that has led me to doing a lot of things, including some projects that I'm currently involved with PSF Germany. And we've been able to train over 120 healthcare providers. We've supported them with some equipment, and we are looking forward, hopefully next month, to help them provide services such as free A1C test for all patients with diabetes. So this is where I get my motivation from. And I think I got it quite early. And that is able to help me overcome any challenge I come across along the way.
Such an inspirational story, and seeing our patients as people first and the challenges that they face help us all be better providers each and every day, no matter what our care setting is, no matter what our job title is, no matter where in the globe we're doing our work. It all does make a difference every single day.
Thank you very much. And I really buy into that. So usually when I talk about patient-centeredness, I do so with personal, passion, personal commitment. Patients come to us understanding the power hierarchy within the healthcare systems. And I think this is something every healthcare provider must know. And sometimes when I engage with my colleague professionals, and they tell you, so today I went to the hospital, not in uniform, but as a regular patient. They actually feel how our patients also feel when they approach health systems. So when patients come to us, it is such a privilege for us to attend to them. And we should make sure we are engaging them meaningfully, treating them with dignity and respect, and incorporating their needs into whatever intervention we, come up with, if the goal is to improve upon their health.
It has been a delight today to speak with Thomas Hinneh about patient-centered care. I hope you have been as inspired as I am to go forth and do good work. This is Geraldine Warfield, your host, and we will see you next time.
Thank you for listening to Heart Nurses. We invite you to visit pcna.net for clinical resources, continuing education, and much more.